Hi there. I'm Dr. Cooper, Program Director at University at Buffalo Surgical Residency. I'm recording this presentation so that you'll have an opportunity to review it ahead of time, reflect on it, and really dive into whatever questions you might have on the day of our interview. You've probably already done a lot of research, looked at our website, looked at some of our social media, and I don't want to rehash every detail about our program. I would, however, like to give you some of what I consider to be the highlights of things that make us special. This is an outline of what we're going to go through. So first, I'd like to start with our team. We have a large team, and through this, we have a wide array of experience, clinical specialty, and different representation of locations where the residents travel. So we have Dr. Schweizberg, the chair of our department. I think it is important to note that he really takes the time to get to know every single resident personally. He knows them by name. He makes it a point every month to meet with seniors and the juniors to discuss educational topics. He's also extremely well connected nationally and globally, and so he's a great asset when it comes to bringing speakers in for networking, as well as helping our residents to find fellowships. I myself have been doing this for 4 years now as program director. I finished training here in Buffalo in 2014, and I immediately signed on doing trauma and general surgery, which I think is a reflection of the strength of the training here. I did that for 3 years, and then we opened up our critical care fellowship, and I was the inaugural fellow. So I actually went back and did another year of training at that time while still doing a little bit of part-time work as a trauma surgeon. Throughout all of this time, I was very involved with the residency and education, served as an associate program director, and after completing my master's in education, took on the role of program director about 4 years ago. We have a host of associate and assistant program directors. You can see them all listed here, representing trauma, vascular surgery, breast surgery, oncology, colorectal, and MIS, all respectively. They come from a variety of institutions and also represent a variety of our local institutions here. We also have Dr. Lamb, Director of Surgical Education, a dedicated educator that is not a surgeon. So he serves as both a wellness resource for the residents as well as an educator and assistance with the curriculum. Melissa Beckman, you've probably communicated with a lot already. She's our training program administrator extraordinaire. She's actually won an award for her role in this nationally. She leads a great team of Hannah, Jennifer, and Katie. It's incredibly important to have a very strong residency office staff, as important as it is to have a great residency and great faculty. These are the people who make sure that all the I's are dotted and the T's are crossed, things that make you board eligible, and also the things that help you get credentialed at future institutions. So where we work, this is one of the unique things about our program. I think that stands out compared to other programs. We have several sites. Sometimes you'll see it written as 6, sometimes you'll see it written as 7. That's because 2 of them are somewhat combined at the Buffalo General Medical Center and Gates Vascular Institute. This is one of our main hubs. About a third of the residents are here at any given time. This is a tertiary referral center for vascular and surgical oncology, as well as acute care surgery, and a whole mix of other things as well. Connected to that, we have the Oshai Children's Hospital. This is a standalone children's hospital where the residents get their pediatric surgery experience. This serves as a level 1 trauma hospital for children. We have the VA hospital, which is very much like any VA that you'll find in the country, gives a very unique opportunity to take care of a very special patient population and also provides for a lot of opportunities in learning. The Erie County Medical Center is where I work. I do trauma, acute care surgery, and general surgery. This is the only level 1 trauma center in our region with a catchment basin of over 1 million population. We see a penetrating trauma rate of about 11 to 15% any given year. So we have a huge variety. Given the four seasons, as well as the really diverse landscape in this area that varies from rural to city to suburban, we see a variety of traumas, everything from car crashes, motorcycles, ski accidents, farm accidents, and plenty of gunshot wounds and stabs as well. So the residents get a really amazing trauma experience as well as trauma ICU experience, in addition to transplant and a variety of general surgery and vascular surgery as well. We have the suburban hospital, which really gives more of a community feel. Many of our graduates are attendings at this hospital, so they're still very engaged in teaching, but you see a bit more of the bread and butter surgery here. There is also a related ambulatory surgery center that is not connected to this hospital, but very close by, that the residents get to take some experience at as well. And then finally, there's Roswell Park Cancer Institute, which is a standalone cancer center, one of the first in the country. And so the residents get some of their more specialized opportunities there. Now, as an outsider to Buffalo, you may wonder about your commute with all of these hospitals. So most of the hospitals you can see are clustered in the bottom left there. That's downtown Buffalo. They're within a couple of blocks of each other. And so that is the kind of main hub of where all of these are. It's about a 5 to 7 minute drive to the Erie County Medical Center there. Again, that's our trauma hospital and county hospital. About another 5 minute drive up to the VA. And then maybe another 10 to 15 minutes to Millard Fillmore Suburban Hospital, out more in the suburbs. On a typical morning, you can actually get from the suburban area to downtown or the reverse in about 15 to 20 minutes. So despite the variety of locations, it is quite drivable. And that's one of the real assets of Buffalo, is there's a large infrastructure of roadways that make rush hour traffic and non-rush hour traffic very manageable. You can also see on the left side of your screen there our proximity to Canada. And so that's been very beneficial for some of our residents who have family in Canada or need access to Toronto for a bigger airport, etc. Some of the things to keep in mind in Buffalo, in general, even though housing costs are going up everywhere, it's still a relatively low cost of living compared to the income. Many residents choose to purchase homes, and really anywhere that you could live would be maybe 5 to 25 minutes from a hospital. You can choose where you want to live, whether you want more of a city feel with everything in walking distance, or whether you want more of a suburban feel with a yard, even a big yard. I live on several acres myself. There's a whole variety of different things that Buffalo offers. And then lastly, I think it's also important to point out the great school districts. So some of you may have families or maybe looking at starting families. You might be thinking about sticking around where you train. And the school districts here are just outstanding. I can speak for myself as well as many of the other faculty. We have our kids in public schools because they do just great. You probably know a bit about sports in Buffalo. The teams are somewhat famous. I think the fans are even more famous. So the Bills are always kind of the biggest thing that's known nationally, the Bills Mafia. Whether the team's winning or losing, the fans are ever present and engaged. We do have hockey, we've got AAA baseball, we've got the Buffalo Bandits, and a variety of other teams as well, but sports are a big thing here. There's also a great variety of food in Buffalo. So there's a restaurant on practically every corner. There's a lot of different authentic cuisines with many, many ethnicities represented. And so that gives you an opportunity to get a big variety of different types of food. There's a lot of national chains, but even more importantly, I think there's a lot of family-owned and local restaurants as well. There's also a lot of microbreweries. So if anyone is interested in the craft brew scene, you'll find a lot of that here as well. And then there's some local favorites. So of course, buffalo wings, sponge candy, beef on weck are some of the things that you just really have to try if you come here. I think it's important to keep in mind that Buffalo really has all the benefits of a big city, but it really has more of a Midwestern feel. So there's a lot of arts represented here, museums that you can go to. There's a lot of places where you can go for classical music, theater, all of the big shows come through here, and you can actually get a ticket, a parking spot, and make it to the show. There's a lot of outdoor concerts. This is a picture from Canal Side, which is downtown on the water. It's a beautiful area that was really only built up in the past 10 or 15 years and has become a great attraction. There's also a lot of historic buildings, classic architecture, and a lot to see here. As I mentioned, there's the Buffalo waterfront, so a lot to do on the water. And again, you get 4 seasons here. So you've got skating and sailing, water skiing, regular skiing, and everything in between. Many of our residents and faculty are very active outdoors. So we've got a lot of runners, bicyclists, and other people that like to do a variety of things outside. And again, that's during all seasons. So let's talk about the program now. That's enough about Buffalo. As far as the program goes, I think we have a variety of resources that really make this program well equipped to train you well. So we have a variety of skills labs. If you were here, we would take you downtown to the UB Medical Institution, where you can see in the bottom middle there's a humongous lab, big, shiny, beautiful room for 17 cadavers. We've had a variety of courses put on here, but this is also a space that we're able to regularly use during our protected time on Thursday mornings, oftentimes with multiple cadavers or other types of open and laparoscopic skills. We have an endoscopic skills trainer, a laparoscopic skills trainer, and coming very soon, hopefully by the end of this calendar year, we have a Vertimed robotic simulator coming, dedicated just for simulation for our residency. We also have multiple satellite labs at some of the other hospitals so that when residents are on call or maybe before or after a shift, they're able to just get a little bit of practice in, including FLS skills, other laparoscopic skills, and open skills as well. We spend a lot of resources on ABSITE and board prep. We've really made a push over the past 2 years to protect our Thursday morning time more aggressively. And so now the expectation is that everyone is in the seats on Thursday mornings. We, of course, understand when there's acute emergencies or acute patient situations, but the default is that everyone is there. We do still include the SCORE curriculum and question bank, as well as a TrueLearn question bank with 3 structured practice exams progressively throughout the late fall so that residents are well prepared to take their in-service exam in January. We've grown our mock oral exam program over the years, and we put it on for all 5 PGY levels, again in a progressive fashion, mimicking the actual exam by the time residents get to PGY 5. And we also invite our graduates back to participate in mock orals as well as they prepare for their exam. Every year we've got Grand Rounds programming weekly, but we have at least 10, oftentimes more nationally and internationally known guest speakers per year. Again, with Dr. Schweizberg's connections, this allows for a variety of networking for the residents and faculty as they get to meet these experts in a variety of fields. We've also participated in Surgical Jeopardy at ACS and even made it to final contestants. Of course, there's some extra perks you can look forward to. We have, I think, one of the most generous educational stipends in the country with a $2,000 annual education stipend, in addition to the resources mentioned. We try to put on a variety of wellness events. We have a newly incorporated wellness chief this year as well to help give us an idea of what's most important to the residents. And as far as scheduling goes, I think it's important to, as you're comparing different programs, to look at how they're doing their scheduling. So the board requirement is that, not counting medical leaves, everyone have 48 full clinical weeks per year, which leaves 4 non-clinical weeks per year. Some programs will withhold 1 or 2 of those non-clinical weeks in case you need time for interviews or conferences. But we make sure to schedule out all 4 non-clinical weeks for all residents, knowing that they still have to use that time for interviews, conferences, etc., but attempting to maximize it as much as possible so that that time is fully utilized. Also, the ACGME requires at least a 24-hour period off every 7 days. We, however, really try to make it an effort to have at least 1 true day off in 7, meaning you go to bed in your own bed, you wake up, have your day off, and then go to bed in your own bed before coming back to work. We also have a variety of sponsorship for conferences and other professional development. Now, here's where it really is the cases. Obviously, this is one of the most important things and most exciting things as you're going to get into embarking on your training. So here's our numbers from last year. Our graduating chiefs frequently are at, above, or around 1,000 major cases as they graduate. This past year's class had 983. The requirement is 850, so we are well over that requirement. And the requirement is at least 250 chief cases, and they averaged 275. You can see all of the pictures here with multiple residents operating. I like to point out that I took all of these pictures, and since I was holding my camera, that means I was not scrubbed. And so many of us really enjoy watching residents take other residents through cases and really focus on that progressive autonomy. As an incoming intern, I think you may be especially interested in the intern cases. So the PGY2 minimum is 250. That's a hard stop from ACGME. Our intern class averaged 176, so they are well on their way towards that minimum and beyond. Oftentimes I'm asked about faculty and feedback. So we have at least 60 faculty. Really, we're well over 100 when you consider all of our volunteer and peripheral faculty. Over 25 of them serve as advisors, giving a much more intense involvement with residents. We have end of rotation evaluations for feedback. These are group evaluations where Melissa or Mike will facilitate these evaluations and really make sure that the feedback received is current and cohesive. We also have the mock orals described, skills labs. We utilize video-based reviews. And we've also, of course, incorporated EPAs, as that's a new requirement from the board, and we've had great success with requiring at least the minimum of EPAs and getting those. We also utilize self-assessment as it is critical for adult education to reflect, but it also is very helpful as a conversation starter between the residents, advisor and themselves, or myself and the resident. All residents are required to have individualized learning plans, but for residents that need a little extra help, we help by engaging them, utilizing additional resources like the PDs, the APDs or myself, the Director of Surgical Education, and their advisor to make the individualized learning plans more intensive for the residents who need that. So I think the residents really speak for themselves. I hope you've been able to spend some time getting to know them in the little virtual get-together before this or during the day today. They really are, I think, the heart of the residency and the most valuable part of the residency. They care about each other, they work hard, they look out for each other, and the camaraderie amongst them, I think, is really special. Somehow we manage to select for that every year and really maintain that. And the credit really goes to them, especially the leaders in their classes. There's a lot of avenues for involvement with the residency. So if you'd like to really be able to make your mark, we have a resident leadership committee. This is led by the administrative chief residents with 2 representatives from every PGY class. They are chosen by their peers. They participate in the management of the program, and they really are my brain trust when problems come up, when we're looking to make a change. Whenever possible, we like to bring that to the residents. We will bring it sometimes in a town hall setting, but a lot of times the work is really done in RLC as we really analyze the pros and cons of any change. We do have the town halls at least monthly, sometimes with, sometimes without program leadership as an opportunity for residents to have a voice there. We also have a resident-driven incoming intern boot camp that you'll participate. If you come in, if you come here, gives you some practical, on the ground, getting ready material. And our resident educators really drive that boot camp. There's also a UB residency committee, so we have representatives on that. And we have a program evaluation committee, which is a combination of residents, faculty, and staff who evaluate the residency at least once or twice a year, looking at the overall direction. Our community engagement and diversity efforts are still robust. We have an annual endowed lecture series called Beyond the Knife. There will be more information at the end of this talk about the one coming up in February. The residents and faculty and students even have participated in neighborhood foot care clinics. We host a summer research fellowship in surgery, helping to engage early medical students, giving them early exposure to surgery. Work has been presented at SBAS. We also engage with the community, some of their schools, and local mission. And the residents have really enjoyed partnering with some of the Buffalo City schools in some of the activities, particularly in the summer. One of the things that I think is most attractive about the residency is it's kind of a choose your own adventure, and no doors are closed. So many of you probably don't know exactly what you want to do with your life yet. Maybe you have an idea of the specialty that you want or an idea of the type of career that you want, but you may not know exactly where you're headed yet. And so the nice thing here is we really can prepare you for anything. So we have the resources to match you into any fellowship, not just certain fellowships. We also have the resources to make you a great general surgeon ready for private practice. There's a variety of things that you can do for professional development with a lot of really unique opportunities that you're probably not going to find anywhere else. We have an integrated MBA program, which completes an MBA over the course of 2 years, but it's integrated into a PGY level of training. And so it allows you to add just 1 year to your training while you complete your entire MBA. We have had residents do that during their PGY 2, 3, or 4 year. We've had residents do MPHs, Masters in Engineering, Masters in Education, as well as fellowships in bioinformatics, critical care, palliative care, global experiences. And so all of these add up to very unique opportunities that are really hard to find elsewhere with a lot of flexibility. Residents go out frequently after their PGY 2 or 3 year, but we've had them go out even after PGY 1 or 4, depending on the circumstances. You can see the fellowship placements here. Again, a huge variety: vascular, colorectal, MIS. In the slightly more distant past, we've had pediatric surgery, and we've got a couple residents coming up going into pediatric surgery that I'm confident are going to be successful in their match. A variety of surgical oncology, breast care, hand surgery, pretty much anything that you can think of, we've matched into it. So what are the takeaways? Well, again, I really think this is it. It's about the residents and about the faculty and the department as a whole. So here we've got some residents and faculty enjoying their time dressed up, Christmas parties, meeting up together between alumni and current residents and faculty at conferences, getting together for the holidays. This is where you put the work in. You put the work in the skills lab, on the wards, in the OR. You do your practice, you do your time, all so that someday you'll get to do this. Operate, do the case, stare at the sunrise after a busy but productive call, maybe even walk up all 12 flights of the hospital, as you can see in the middle there. So that is just about it. You'll hear from Melissa about the plan for the day, so we will touch on that as soon as we get started that morning. I do want to point out a couple of opportunities to come visit Buffalo. We'd love to have you here in person, but the virtual interviews seem to work out a little bit better for us and for candidates with the questionable weather and trying to make it fair for everybody. So if you are going to be around at all, please feel free to reach out, even if it's not one of these days. We'd love to have the opportunity to host you here and to show you around. But we do have these two opportunities, which are after all of our interviews are done and rank list is complete. So we have Wednesday, the 25th in the evening, going into Thursday, the 26th, with our didactic morning. Some dinner with residents, participate in our didactics in the morning. Please let us know if you'd like to attend that. That, I would say, would give you the best flavor for the residency. But I'd also like to open the opportunity for you to participate in the Beyond the Knife lectureship, either remotely by Zoom or in person. It's a little harder to spend time with the residents because this event is generally packed and turns into kind of a later evening. But if you come for the Beyond the Knife lectureship, we will work to set up lunch with the residents and non-administrative faculty to meet with you as well. So that completes everything that I have to review with you before your visit with us. We are really looking forward to getting to know you more. We've enjoyed looking at your applications. We think you are all wonderful candidates that would be a great fit here in Buffalo. And we really look forward to answering any questions you might have and getting to know you a little bit better. Good luck today and on your interview trail.